A number of individuals who've had polio in their younger days are now presenting with a constellation of features which include pain, weakness and fatigue. It's not a reinfection of polio, it's really either a progression of the neurological damage that occurred with the polio when they had their poliomyelitis all those years ago, or a consequence of the biomechanical stresses and strains that their body has gone through due to the original weakness that they were left with after the poliomyelitis infection. Post-polio syndrome is really a constellation of symptoms that I mentioned before: weakness, fatigue and pain, with some other features as well. People may well have swallowing difficulties, respiratory difficulties, temperature changes, mood changes, behavioural changes, but it's really an effect of the wearing out of the remaining nerves that were there after the original poliomyelitis infection. I like to think of the late effects of poliomyelitis being a little different to post-polio syndrome, although there are a lot of similarities. But really the late effects of poliomyelitis are due to the wear and tear on the body and the stresses and strains due to the original weakness, fatigue, and the effects then on the rest of the body. A classic example would be arthritis in the left leg when someone has had polio affecting the right leg. It's the extra burden that that left leg has had to carry that's worn it out. I think what you can say is the late effects of polio become more apparent in the non-affected parts of the body. So you can align, if someone's got a left-sided leg weakness, then you'll see a lot of effects on the right side of the body which has been used to adapt for that left weakness. But it's not exclusionary. You can have effects on the left side of the body as well. Whereas the post-polio syndrome features tend to be generalised and affect all limbs, and it vary in the way it presents, depending on the demands on the body. Not necessarily. It depends on the extent of the original infection, the age of the original infection, and the lifestyle of the individual. We would estimate at least 50% of individuals who did suffer polio, and what I'm talking about when I say suffer polio, have paralytic polio with some weakness left after the original infection, never report any symptoms. But those who do report symptoms can relate it back to the original infection and the weakness that remained after that infection. There's a rule of thumb with post-polio syndrome, and that is that the younger you are, that is under the age of 5, and the less severe the attack, the less likely you are to develop post-polio syndrome. You can't say the same thing for the late effects of polio because if you're looking at the biomechanical issues with that. But certainly from that progressive disorder that is known as post-polio syndrome, there is a correlation between the severity of the original presentation and the age. It was really probably the late 80s, early 90s where a lot of more emphasis was put on the impact of the polio on individuals later in their life. But there was a lot of discussion about it even in the 50s, 60s and 70s when polio survivors were starting to not be as efficient in their lifestyles as they previously were. What you have to remember is this is a group of individuals who are very strong-willed and very determined, because after their original infection they had to try and keep up to be normal, whatever normal is, and by that they had to work at 110% compared to the able-bodied individual who worked at 100%. That's the way they operate, but as they get a bit older their body doesn't keep up with their mind anymore, and you'll often find that you still have this vibrant, intelligent individual who's striving and striving, but they're getting frustrated because they can't keep up in the same way as they used to. I think probably the first answer is be sensible. Pace yourself. Look at your day, conserve energy, be ergonomically smart, set your kitchen up, set your office up, set your car up so that you're not putting extra stresses on your body. Take time out. One of the biggest things that I find that frustrates polio survivors is they have to take 30 minutes out in a day to rest. Because their mindset is of being of someone who wants to do, they see that as wasted time. What I often suggest is, okay, if you need that 30 minutes, hour rest in the day physically, pick up the newspaper, pick up a book, stimulate your mind, use it, look at it in another way. It's still a time that you can be positive in your lifestyle, but you do need to protect the rest of your body. We believe that that's due to the dropout of neuronal function, so we're losing nerves over time. What happens is after the original infection, the remaining nerves have to take on the role of the nerves that have been lost. And they do this by for want of a better term, sprouting out to cover more muscle by one nerve. But it's like sending a 9-man soccer team to play an 11-man game. Sooner or later, the 9-man team becomes less efficient. And that's what happens with the body's neuromuscular system, the nerves and muscles, that they become less efficient. And the way that presents is fatigue. You tire. It's overwhelming. It's not just a physical fatigue as well, and that's the thing that people don't necessarily understand. It's often cognitive as well. They feel like they're forgetting things. They can't pay attention, and it just comes in a wave that they basically become, for want of a better term, paralysed totally and too tired to do anything. I think the answer to that simply is it will be with them for the rest of their life. What they need to be able to do is adapt and adjust to meet the demands of their life compared to what the effects of the polio is having on them. And what I mean by that is that you'll often find when initially they're so strong-willed and want to keep battling on that when the symptoms first start occurring, they deny what's happening and force themselves harder, which is really a destructive course. The sensible thing to do would be to sit back and say, I can't do this anymore in this way, I need to adapt. But that's not the way we operate in our response to a challenge. So the first response is to, I'm going to beat this. But the problem is they don't have the reserves to beat it after time. And it wears them down. And it's often 4 or 5 years down the track from the time when they first started having their symptoms that the situation arises that they get into a bit of trouble and then they present. They need to have a balance. Yes, they should be exercising because they need to have the conditioning. If you don't use your muscles, they also weaken. But it needs to be a balance of light aerobic activities and maybe some light resisted activities, but you don't do it to the point of exhaustion, which tends to be a challenge for the polio survivor who is an achiever. So you give them a prescription for 10 repetitions of an exercise and they'll do 20 to show you that they're listening to you closely. They want to achieve. You actually don't diagnose it by looking at the person. It's a combination of features. Certainly you do look at the person, examine the person to establish that there's evidence of polio occurring in the past. But you look at the picture, you look at the history, what's been the presentation over the years. They had a period of when they had the initial infection and the recovery with residual weakness, a period of latency where things just steadily went on. They played sport, they had a career, they raised a family. Then all of a sudden, their physical expertise, their general functioning starts to drop off. And you'll often see they adapted things, they pulled out of doing things that they were doing before. Their fatigue gets greater, their pain gets greater, they feel weaker. And that tends to increase with time. And it's really the combination of those two things will give you most of the answers. If you wanted to find whether a person's really had polio, you may do a study called an EMG, which will show that the muscle has been affected. But that doesn't tell you that you've got post-polio syndrome. That only tells you that you've had polio. The issue for that, for me, would be that someone's given a label and everything's then blamed on polio. But they're human beings and they can have other conditions as well. So I think we need to be very alert when we look at someone and make sure that we're not missing anything else and putting it all down under polio. And I've had patients present with strokes, multiple sclerosis, orthopaedic conditions, which people have attributed to the polio diagnosis, late effects of polio diagnosis or post-polio syndrome diagnosis, but really there's something else going on. So it's important as a physician or a treating practitioner that you are sensitive to the person. You look at the person holistically, not by the diagnosis. They can have a variety of pains. There can be the specific joint pains, the soft tissue pains. They can have gnawing pain. It can disturb their sleep. They can have what's known as neuropathic pain, which is a burning sensation in various parts of their body. They can have sensations of extremely cold limbs, which at this time of year in winter is particularly problematic and very difficult to treat. They can have anxiety associated with the pain because the pain is stopping them doing things and being individuals who like being in control. They can set up a pain syndrome. So there's a lot of ways that the pain presents. Usually what the person will present with though is the pain stopping them doing a particular function or activity that they like doing. Well, usually an individual will have a weak limb, which may be getting weaker, but they also find that they're getting weaker in other limbs. One of the problems is when we medically examine someone, we often do what we call a confrontational test, where we just test it once or twice. But if you look at what happens with the polio survivor, they can do the activity for a while and the weakness sets in. So when we really test people, we should test them functionally and repeat the activity a number of times to watch the propagation of the weakness. There is a correlation with respiratory difficulties and polio. Polio survivors often get labelled as having asthma or like, but it often can be due to restrictive lung disease because of weakness in the muscles or changes in the thoracic spine or chest wall. And that needs a respiratory physician involved. Sleep apnea, where they have problems with breathing overnight, is often complained about, particularly by their partner who says they're snoring all the time. And that needs to be addressed with a sleep study because there are mechanisms to manage that now. The problem if you have obstructive sleep apnea is you don't oxygenate your body correctly and you don't wake up refreshed, and that can aggravate your fatigue. So if you treat the obstructive sleep apnea, that can improve that as well. Sometimes you've got to address the psychological issues of the loss of control. You're talking about individuals, i.e. polio survivors, who have managed their lives. They've taken control, they've held their own destiny. All of a sudden this process of fatigue, weakness, pain, whatever, starts robbing them of doing that. And that takes a lot of adjustment from a psychological perspective, and sometimes counselling needs to be undertaken as well. That's a very good question because it's hard to know, because often the individuals are unaware or don't want to know about these diagnoses to start with. But probably the simplest answer is sensible living. Exercising correctly, not overstressing your body, dieting correctly, having regular medical checkups to make sure you're healthy. Dare I say, good clean living.